Biological treatments for mood disorders. While psychological treatments remain a core component in managing mood disorders, biological interventions, particularly medications and neuromodulation therapies, often serve as frontline treatments, especially for moderate to severe cases. This section provides a deep dive into the main biological strategies used in treating major depressive disorder, MDD, and bipolar disorder, including medications, electroconvulsive therapy, ECT, and repetitive transcranial magnetic stimulation, rTMS. Antidepressant medications, the four major classes. Antidepressants are among the most prescribed psychiatric medications, with over 18.5 million prescriptions filled annually in the United States alone. These drugs offer quicker symptom relief than psychotherapy, making them a critical tool, especially for acute depressive episodes. There are four main categories of antidepressants, each with unique mechanisms and profiles. 1. Monoamine oxidase inhibitors, MAOIs. Example, tranylcypromine parnate. These were among the earliest antidepressants. They work by inhibiting the enzyme monoamine oxidase, which breaks down serotonin, dopamine, and norepinephrine. However, they require dietary restrictions and can have dangerous interactions with certain foods and other medications. Tricyclic antidepressants, TCAs. Examples, imipramine, tofranil, amitriptyline, Elavil. These block the reuptake of norepinephrine and serotonin, boosting neurotransmitter levels in the brain. While effective, TCAs are often associated with side effects like weight gain, dry mouth, and cardiovascular issues, limiting their modern use. 3. Selective serotonin reuptake inhibitors, SSRIs. Examples, fluoxetine, Prozac, sertraline, Zoloft. SSRIs work by blocking serotonin reuptake in the brain, increasing its availability. They are widely used due to their improved safety and tolerability, although they can still cause sexual dysfunction, insomnia, and gastrointestinal issues. Serotonin norepinephrine reuptake inhibitors, SNRIs. Examples, venlafaxine, Effexor, duloxetine, Cymbalta. SNRIs enhance both serotonin and norepinephrine activity. They're often used for depression, with comorbid anxiety or chronic pain. There is an important consideration. Despite their popularity, antidepressants are most effective for severe depression. Research by Fournier and colleagues in 2010 shows that their benefits over placebo are minimal in mild to moderate cases. Roughly 60% of users experience at least one side effect, and many discontinue use due to issues like nausea, weight gain, and sexual dysfunction. Furthermore, the FDA mandates a black box warning for SSRIs due to a slightly increased risk of suicidal ideation in individuals under age 25 during early treatment or dose changes. Electroconvulsive therapy, ECT, misunderstood but powerful. ECT remains one of the most effective treatments for severe, treatment-resistant depression, particularly when psychotic features are present or rapid symptom relief is critical, like suicidal ideation. Despite its controversial history, modern ECT is much safer and more refined. How it works. A small electrical current is passed through the brain to induce a controlled seizure, typically in the non-dominant hemisphere to minimize side effects. The patient is under anesthesia and receives muscle relaxants. Frequency, usually 6-12 sessions over several weeks. Effectiveness. ECT has been shown to outperform antidepressants in severe MDD cases, especially in elderly populations. Side effects. The most common are short-term memory loss and confusion, which typically resolve post-treatment. Long-term cognitive issues are rare. ECT is reserved for cases where pharmacological and psychotherapeutic treatments have failed. However, its efficacy and safety profile have earned it renewed respect among clinicians treating refractory depression. Repetitive transcranial magnetic stimulation, rTMS. A modern alternative, rTMS is a non-invasive neuromodulation technique FDA approved for treatment-resistant depression. It works by stimulating the left dorsolateral prefrontal cortex using magnetic pulses. Procedure: an electromagnetic coil is placed on the scalp. Patients undergo 30-60-minute sessions for 10-30 days. Advantages: it has fewer side effects than ECT and does not require anesthesia. There's no memory loss or seizures. Evidence: multiple randomized controlled trials have shown its benefits over sham treatment, with symptom improvements persisting for up to a year. Medication strategies for bipolar disorder. Managing bipolar disorder biologically revolves around mood-stabilizing medications. These include 1. Lithium. The most well-researched mood stabilizer, lithium is highly effective for both manic and depressive episodes. Benefits: reduces relapse risk by up to 40%. Caveats: lithium requires regular blood monitoring due to its narrow therapeutic range. High levels can be toxic. Anticonvulsants. Example: divalproex sodium, Depakote. Originally used for seizures, these also help stabilize mood. They are useful alternatives for individuals who can't tolerate lithium. 3. Atypical antipsychotics. Example: 3. Atypical antipsychotics. Example: olanzapine, Zyprexa. These medications treat acute mania and have mood-stabilizing properties. They are often used in combination with lithium for faster symptom control. Combination therapy. Acute manic episodes are often treated with a combination of lithium and antipsychotics. Once stabilized, long-term monotherapy with mood stabilizers is continued to prevent relapse. A notable complication in treatment is the use of antidepressants for bipolar depression. Antidepressants can trigger manic episodes if not paired with mood stabilizers. Hence, they are prescribed cautiously and typically as adjuncts. In the next episode, we will examine suicide. Stay tuned.